Joint Commission versus CARF is the choice that decides whether you accredit one program or your whole organization, and which payers and states will even contract with you. Both are voluntary, but in some markets the wrong choice can lock you out of insurance panels and public programs. Joint Commission versus CARF. Here is how the two leading behavioral health accreditors actually differ, and how to choose the one that fits your programs. We cover scope, survey philosophy, cost, deemed status, and the documentation that gets you survey ready. Two major accrediting bodies dominate behavioral health: CARF International and the Joint Commission, formerly JCAHO. CARF International is an independent nonprofit founded in 1966, known for a consultative, peer-driven approach to accreditation. The Joint Commission, founded in 1951, is the other leading accreditor, often considered the more medical, compliance-driven model. Neither accreditation is required by federal law for most programs, but state rules and insurer contracts can effectively make one of them mandatory for you. In some states or markets, insurers will only contract with behavioral health facilities accredited by the Joint Commission or an equivalent body. Several states mandate Joint Commission accreditation to receive Medicaid funding for certain services, so the choice has real revenue stakes. Whichever accreditor you choose, the work is documentation. A robust EHR can help organize the records required to pursue and maintain accreditation. When an accreditor requires tracking of outcomes, your electronic health record can be configured to capture and report it, rather than doing it by hand. Behave Health is designed to keep policies, plans, and client records organized, so evidence is ready when surveyors ask. Both attest to quality and safety, but 4 differences will steer your decision more than anything else: scope of accreditation, survey philosophy, how the survey is scheduled, and deemed status. Let us walk through all 4. Difference 1 is scope. CARF accredits specific programs or services, so you can accredit just your outpatient program without accrediting the entire agency. The Joint Commission typically accredits the entire organization, evaluating all services for which it has standards. Difference 2 is the survey philosophy. CARF is consultative and peer-driven. Surveyors focus on whether your practices make sense and achieve quality, even if methods vary. The Joint Commission is more standardized, using tracer methodology and strict scoring, and is more prescriptive on safety-critical standards. Difference 3 is how the survey arrives. CARF tells you exactly when the survey will happen, so you can be fully prepared for that date. The Joint Commission comes unannounced within a target window, which demands sustained, continuous readiness. Difference 4 is deemed status. Joint Commission accreditation can confer deemed status, satisfying CMS conditions of participation for provider types like psychiatric hospitals. CARF is not used for Medicare deemed status in the hospital sense, though it may help meet other federal grant or Medicaid expectations. The standards overlap heavily, but the emphasis differs in ways that matter for your program type. Unlike CARF, the Joint Commission explicitly requires accredited behavioral health providers to maintain a trauma-informed approach throughout their programs. A Joint Commission standard, CTS 03.01.09, requires behavioral health organizations to use standardized outcome measures to assess progress. CARF emphasizes person-centered care, involvement of persons served, rights, diversity, and measurable outcomes for clients. There is no one-size-fits-all answer. Your program type and special certifications point you toward the better fit. A medical detox or inpatient psychiatric hospital may align with Joint Commission, which can be required for Medicare. CARF is the exclusive accreditor, offering ASAM level of care certification for residential treatment programs. On a few points, the two accreditors converge, and one cost note is worth flagging. Opioid treatment programs federally require accreditation by a SAMHSA-approved body, and both CARF and the Joint Commission are approved. In both cases, accreditation is typically awarded for up to 3 years, with shorter durations possible if there are issues. Costs vary by size, but Joint Commission can be more expensive, especially for larger organizations, due to annual fees and survey structure. Behave Health is designed to organize the documentation either accreditor reviews, so evidence is ready whether your survey is scheduled or unannounced. The platform is designed to keep policies, treatment plans, and client records organized to show evidence against applicable standards. Outcome tracking can be configured into the record, supporting standards like the Joint Commission's outcome measures requirement. Standards-aligned workflows are designed to support the continuous readiness and unannounced Joint Commission survey demands. Stop scrambling for accreditation evidence. Book a 20-minute demo of documentation built for CARF and Joint Commission readiness at behavehealth.com. See how Behave Health organizes the records both accreditors review at behavehealth.com.